Good morning, everyone, and welcome. I'm Rob Lane, Executive Director of the California Association of Alcohol and Drug Program Executives, or CADP. Thanks for joining us today on our webinar on substance use disorder and the Behavioral Health Services Act community planning process. I want to start by thanking the Department of Healthcare Services for planning and hosting this session, and also for inviting CADP and our provider network into this conversation. We really appreciate the chance to bring a strong substance use disorder provider lens to a webinar that's being offered statewide, and to make sure that our members and providers across the state who do substance use disorder services, that they are able to engage fully in what comes next. For those newer to CADP, we represent substance use disorder and behavioral health providers across California, and our role is to advocate for your voice in decisions like this, especially when new funding and planning structures are being built at the county level. The Behavioral Health Services Act is a major transformation, and how the community planning process unfolds locally will shape who gets heard, what gets prioritized, and ultimately how resources will ultimately flow. This morning, Department of Healthcare Services will walk through how the behavioral health planning process works at the county level, the specific ways providers can participate and be represented, and what DHCS is looking for to ensure substance use disorder providers have real access to programs and funding. Most importantly, this is a chance for DHCS to hear directly from you, to figure out what's working, what isn't, and what needs to change so implementation matches reality. We're really grateful to be joined by DHCS leadership today, including Marlise Perez. Marlise, thank you for being here and your partnership for this, but also for the work you do every day. Thanks, Marlise.
Thank you so much, Rob. And thank you all of folks that are joining us today live and anybody that's watching the recording. And we're just going to dive right in. I will have time at the end for questions. So if you want to pop any questions in the chat along the way, that would be great. But then also we'll have time at the end to, if you think of something, then we can answer those questions then. So with that, we can move forward. And Rob already did an excellent agenda setting for me, so I don't think I need to talk more about this. But you are going to see along the way, there's a lot of slides in here that I have included around resources. And I've spoken a little bit about the community planning process in other webinars. But what I've done in this webinar is really tailored it to our substance use disorder providers in California. And so I'm going to talk a little bit more about some of those nuances and some of those resources for you in particular, what you might want to be looking at as you're looking those over. So we can move forward. And next slide. And so what I really want to talk about is the integrated plan. Hopefully all of you are very familiar with this now, that it's a 3-year prospective plan. I think one of the key points to make sure that you're aware of is this integrated plan is more than just the MHSA, the former MHSA dollars that are now BHSA, but it's also all of the funding sources that the counties receive from the department or through settlement funds or through the federal government. And so that, of course, contains specific funding sources just for SUD services. And so I'll highlight those a little bit as we move forward. So next slide. So with the integrated plan, we kind of went through and just we're thinking about if I was a provider, what would be areas that I would want to focus on. And so my team and I put a few of these together. And once again, please, you can look at the entire integrated plan. I don't know exactly everything you do. Maybe you also provide mental health services. So please be sure, to look over that in general. But for SUD specific, just want to recognize there's a budget that's included. There is, by the way, and we have the links in here, there's a whole integrated plan template where you can see all of the questions that we're asking our county partners. In that is the budget. And so once again, there's those SUD specific funding sources where counties are letting us know where they plan to expend those. And those, of course, are for the substance abuse block grant, opioid settlement funds, realignment funds, Medi-Cal. So those are some specific areas that you might want to be looking at in particular. There's also in the integrated plan, our county partners have to address local needs. And so this comes right from the statute of Senate Bill 326. And here's the section here if you want to look it up. But basically, one of the key pieces around addressing local needs is the prevalence of SUD in the county, and then also the unmet need for SUD treatment in the county. And then also SUD disparities. And then also looking at the allocation of funding between mental health and SUD treatment services. So once again, that is all around local need. And I'm going to talk a little bit more about where you can learn more about the local need and different parts of the IP, once again, that you could potentially look at. There's also there's three components in BHSA in particular around BHSA funding, and under the full service partnership component, that kind of whatever it takes, there's a new SUD field-based initiation requirement. That is, of course, very specific to SUD. If you're not familiar with that, that is located the policy in our policy manual in Chapter 7 where it really outlines all of the details around that requirement. And then also just want to highlight under BHSA in particular around housing interventions is that it does include how individuals will be connected that are substance use only. So these funds can also be used for housing services for individuals with an SUD. So once again, these are just a few that we highlighted. There's others, but just wanted to bring that to your attention. Kind of really quick here in the graphic here. This is from the integrated plan, and this is information that our county partners have to provide to us around that new requirement for assertive field-based SUD treatment services. And you'll see here, this is just one example of some information they need to provide. So just wanted to give you a little hands-on there application of like some key places that you may want to look. Next slide. And then as I've been mentioning in the integrated plan, the counties need to prospectively plan out for 3 years how they're going to be expending all of their behavioral health funding sources. And so you'll see here on the right-hand side, these are some of the main SUD funding sources that they'll need to be planning out and providing us information on. And here is one of our first resources. And I just want to call out that this resource here actually has all of the funding sources for behavioral health, but it has mapped out more information about kind of the requirements around that funding source, also has links for more information about it, but also has the most recent allocations of funding, so you can see what your county receives in these different buckets of funding. So once again, another great resource for you to be prepared when you come to the planning processes. Next slide. So with the integrated plan, just want to let you know where we're at in the process. This is really all of the kind of high-level requirements for the county partners. Of course, you'll see right now the stakeholder engagement is occurring. The first actual draft is due to us March 31st. Of next year, and then the final is due in June of next year. I'm going to talk a little bit more about some of the stakeholder requirements and engagement, but just wanted you to see the overall timeline and just highlight that these plans go into effect starting July 1 of next year, which is right around the corner. Next slide. All right, so next I really want to talk about this community planning process that and all the requirements around that. So next slide. So there are very specific stakeholder engagement requires that are outlined in statute around meaningful engagement with stakeholders. So just wanted to call out a few of the highlighted requirements around stakeholder engagement. One is if counties propose to make any changes to the allocation percentages in the county's integrated plan. And what that's really talking about is specific to BHSA funding. Because there are buckets, the 3 buckets of funding around housing interventions, BHSS, and full service partnership. If they're proposing to transfer some funding from one bucket to another, the counties need to get meaningful engagement around that. Also in particular around prudent reserve. And I'm going to talk to you a little bit more about what prudent reserve is, just so you have an awareness and how you can find out what that level might be for the county that you're working with. There's other requirements around stakeholder engagement, but just want you to understand the whole purpose, the legislative intent is to really have transparency for stakeholders into how counties are planning to utilize all of these funding sources, once again, at the local level. Next slide. So I wanted to highlight, this is all of the required groups that the counties need to engage. The bold ones are new to the planning process, new required by the statute. And then I just highlighted two in purple because I know purple's our long-term recovery color. So these in particular, not that the other ones don't have an SUD voice, but I really just wanted you to see that there are providers, you yourselves are called out, SUD providers, and then youth and adults with substance use disorders themselves or participating organizations. So I just want you to know you have a seat at the table. You have quite a few seats at the table, but in particular, you yourselves who we're doing the webinar for today are specifically called out. And so I just want to encourage you to get to the table. And we'll talk a little bit more about that as we move forward. Next slide. So here's another resource. So we have been working with Cal Mesa, and they prepared for us a guide for our county partners around meaningful engagement. And while this guide it's really geared towards counties, there's a lot of information in there that you can learn as well if you're interested. This is a link here to the guide. And then Cal Mesa put on some training for counties on just and answering some of their questions, and they had a webinar here if you're interested in seeing that as well. So once again, just another tool of some information if you want to understand the engagement process more. Next slide. Also, just want to make sure you know statute allows that counties may allocate up to 5% of their BHSA funds. And this is for every year that they receive the funding to support stakeholder engagement. And so we've provided some guidance from the department of what some of the allowable areas are for stakeholders to participate. These are not requirements. Counties are not required to do each and every one of these. However, these are allowances. So once again, your county partners will be letting you know, what they're helping with and what is available. But in case you weren't aware of this allowance, just want to make sure that you had this awareness. Next slide. This is another great resource. So we put this together, excuse me, and it's an infographic available on our website, and I have a link here for you as well. And this really just is outlining what the community planning process is. On the left here, you'll see all of those required stakeholders that I spoke about. There's also some other just information, general information, and this is really a great tool for you to utilize, perhaps within your own organization or when you're out speaking to others if they're not familiar with this process. You'll also notice in the right-hand corner, the bottom right-hand corner of my screen, is a little QR code, and that links you to the coordinators at the county level, the contacts that are planning out their stakeholder engagement processes locally. So if you're not really sure who to go to, that is a place that you can go and find a local contact for you. Next slide. Okay, so this is another just great few resources that I wanted to make sure you were aware of. I've been kind of talking a little bit about the integrated plan template itself. There's also some FAQs because we would not be DHCS without FAQs. So there's some there. Those are a little bit more detailed, but if you're very interested in a certain topic that you don't feel is maybe as clear in the policy manual or you want some more information, those FAQs are available. We've also been providing training to county partners around the integrated plan itself, which is something you may want to just participate and kind of review if you're curious what the template looks like. We once again do some explainer webinars. We also do a guide around the budget itself. So if you're really interested in the budget and want to understand how those pieces work, there's a great manual for that as well. Next slide. This one is a really, really great resource. This is one of my favorites. But in the integrated plan, counties need to uh, put in their proposed expenditures across the continuums of care. And you'll see when you look at the integrated plan template, there's two care continuums. One is for SUD and one is for mental health. So here, just as the infographic, we just pulled to show you the infographic, or excuse me, the chart just for the SUD. And so, but what's really great about this care continuum inventory is we had a lot of questions of like, well, what goes in each category? And so this is a really great guide that can help you determine what goes in each of these SUD categories. So you yourself can understand a little bit more about the different funding sources, the requirements around that of where funding can be utilized. So once again, I think this is a really great resource. If you're not as familiar with all of the different funding sources, I would point you to look at this and understand the categories a little bit, because this, once again, is part of the integrated plan and what counties are providing to us for our review. Next slide. So earlier I talked a little bit about MHSA and some of the and moving into BHSA, but around prudent reserve. So so in current MHSA, there's certain amount of funding that counties are allowed to retain. It's called prudent reserve. And so each county has a different amount. There is no minimum that counties are required to have. However, there are maximum amounts. And so some of this has been changing with the BHSA, but we publish every year at DHCS the prudent reserve levels that counties have. And so what this basically means is, and I'll talk a little bit about how the BHSA funding comes next. However, counties are planning out not only their BHSA allocation of funding and once again those other funding sources, but also if they have prudent reserve. And so once again, it's just good information for you to have to know at your county how much prudent reserve that the county has. So when you're, looking at the budget and just participating in those engagement activities, you have just a better awareness. So once again, this link will take you to the most recent levels of prudent reserve. Next slide. Thank you. And so this here talks once again just about the BHSA allocation. And I just wanted to provide this to you because you may not be as familiar with the BHSA allocation since prior to BHSA, MHSA only allows funding for co-occurring. But now that BHSA broadens and includes for SUD, I wanted to make sure that you understood just the allocation of funding that your county receives each year through BHSA. I do want to highlight BHSA funding is from a tax. I'm sure most of you have heard about the millionaire's tax. So it is a tax revenue, so it does ebb and flow. However, we post every year the allocation and methodology for this funding source. And so I just wanted to highlight, when you look at that, this is the most recent one for 25-26. There's a lot of enclosures, but I wanted to highlight enclosure 12. That one actually shows each county's percentage of the allocation that they receive. And so it also has the allocation schedule, because this funding comes right from the state controller's office down to our county partners. But there is a description of the methodology of how those allocation schedules are determined, and then also the amount of money that the governor's budget has estimated will be available in that fund. So you have that overall number, and then you can use that percentage for that county about how much funding that the counties will be receiving. So once again, a lot more information here. Wanted to highlight it because you're probably not as familiar with this funding source. And so just wanted to make sure that you had this at your fingertips. Next slide. All right, so next I just want to really talk a little bit about this data-informed county planning. So you can go to the next slide. Hopefully by now, all of you know that the BHSA, we've created 14 statewide behavioral health goals. We have goals for improvement and goals for reduction. And there's a lot of components of BHSA that are kind of framed out on this framework, not only for the counties, and I'll talk a little bit here about the measures, but also even with work being done with the Department of Public Health and other agencies that are participating and impacted by BHSA changes. So these 14 goals are really important, and there's a lot more information, and there's a link here to the policy manual where you can learn a little bit more about these. But as you move to the next slide, from these 14 goals, we've been developing measures. And so there's right now what's out for the counties, our phase one measures. These are broader population measures, but we are also setting and in the process of determining phase two measures, which are more for individuals. And so, but there's a lot of information. So right now, I just want you to kind of focus on those phase one measures because that's what's in the integrated plan. And so what the counties are doing in the integrated plan is they need to address 6 of the priority goals and at least one additional goal to work toward. And so we've laid out what those 6 priority goals are that are required. And then once again, they can choose an additional goal. Of course, they can choose more if they like. And then you'll see here on the right, there's a graphic that just kind of shows you a little bit of the information that they need to provide to us on these goals. And so if we move forward, I just want to kind of provide you some information of like what can you do? Then what can you do as you're preparing to go to these stakeholder meetings? And so first of all is really looking at those measures specific. We have a lot of information and I've got a lot of links in here for you of where you can go to kind of see for your county how they're doing on these various measures. And, you know, we just recommend you obviously going and looking at that information so you can, you know, come prepared to discuss that and to really see what your counties are proposing to do for each of those goals that they're required to report to us on and make improvements on. And so, once again, just really having this information so you can participate in these collaborative discussions because our county partners are having to really develop these data-informed strategies on how they're utilizing, once again, not only just the BHSA funding, but all of the funding sources that they have at the local level. Next slide. And then so some of you might be like, hey, Marlise, I'm not really good in the data space. I get ya. I'm not the best either. And so we have this really great data explainer series that we put together for counties, but it is also very valid for our providers as well. You'll see there's many weeks here, but you can go, this is available now, and look at some of those webinars that we have in the areas that you're interested in learning more about the data. So once again, this is something that we have heard has been really helpful. So once again, another resource to help you understand how some of the behavioral health data works. Next slide. And then also, I've been kind of mentioning, go look at how your county's doing with the measures, with the phase one measures. These are the actual links to the workbooks that have those. And then if you're a data nerd, there's also instructions and notes on how counties are to complete this information. That's what the instructions and notes document is. All right. So next, just really want to talk about what's happening locally. What's the review process look like and some of those requirements. Next slide. And so as I mentioned, there has to be this community planning process. That integrated plan has to be circulated for public comment. There also has to be a local hearing by your local behavioral health board where feedback is incorporated, and then the plan has to be approved by the County Board of Supervisors. So these are all different places, not only in those meetings that you could be participating in with the counties of developing the plan or hearing about the plan, but these are other venues that you might want to, take advantage of to provide your feedback. Next slide. And so once again, here's just some information, kind of just want to show you between the requirements and then what the counties have to report to us. So counties have to document their community planning process. You'll see what the documentation requirements is. This is actually in the policy manual, but we also have a little graphic just showing you from that integrated plan template, just some of the things that have to be reported to the department on the planning process. And then DHCS, as we're reviewing and approving these plans, this is one aspect that we're reviewing as a part of the integrated plan process. Next slide. All right, next slide. So how do you stay involved in the community planning process? And so once again, I've highlighted some resources here that can help prepare you. We have others. We have a lot of them, and we're continuing to have more come out. And so keep coming back to our website because we're always posting new infographics or materials in ways to just help prepare you. And so prepare. And really, once again, look at that integrated plan template that is in the policy manual here that we have linked. And then really come to, as you're, prepare to come with some recommendations and look at that data and, really be looking at that local need in your area and come forward with suggestions. And then the next is, if we can move the next slide, is really connecting in. So once again, reach out, find out when the meetings are occurring, find out if they have already occurred. Was there any materials that you need to get up to speed on? Are there upcoming planning activities? And then once again, maybe inquire, are there any SUD specific meetings? Since there is such an SUD focus in this planning process. And then once again, here's just a link again to that BHSA county coordinators list. Next slide. And then engage, show up, attend as many meetings as possible. And I know this is a big ask. You're all extremely busy. You're serving the people in need. But however, you need to have your voice heard. And in order for that to happen, you need to be present through this process. And this is an ongoing process. This isn't a one and done. It's pretty intense right now because the counties are putting together their 3-year plan. They have to do a 3-year plan every 3 years with us. They also have to submit to us an annual update every year, but become involved. And also not only through the County Behavioral Health Department and that part of the process, but attend your local behavioral health board meetings. Once again, as I mentioned, this has to come before your local behavioral health board. And maybe you haven't been to the behavioral health board, maybe because these used to just be mental health boards, but they have since expanded to behavioral health. So if you haven't been to your behavioral health board meetings, we have links here to just help you find out where those are in your area. So go to those and find out when your integrated plan is going to be presented. And once again, bring your voice to that table and focus on that local need of your area. Next slide. All right, so I know I got more resources. I can't help myself. So go to the next slide, please. So another recent resource that we have posted because as with all great things, there's some myths that are rolling around out there around the implementation. And so the department has put forward this myths versus reality document. So once again, we've just put out some of the myths that we've been hearing, and then what is the actual fact and reality guidance. And so once again, please look at that. It really kind of runs the gamut of what we've been hearing, and hopefully this will help provide some guidance and some clarity for you as well. We really talk a lot about the funding sources, the provider and system capacity, stakeholder engagement, and then general behavioral health services. And so I just have one as an example here, part of one. But yeah, please go look at that document and just learn a little bit more about this process. Next slide. So another really great resource, and I picked this one just thinking about for our SUD providers. I know a lot of you are in the care continuum, more around the prevention or treatment services for individuals. But there has been a lot of changes over the last few years around housing, and especially with the under the BHSA funding, that one component I was talking to you about, housing interventions, that's 30% of the funding that our county partners will be receiving annually. And that is for housing services. And once again, those are housing services for mental health and or SUD. And so maybe you're not as familiar with the housing world. I know I have been learning a lot about it over the last 4 years. And so what we've put together is this really great graphic around housing. And for behavioral health, this is really just for behavioral health. And so this is one place that you can kind of learn a little bit more about the various fundings, learn a little bit more about the settings. And then also, there's a lot of great, maybe you're really new in the housing space. There's some really great housing webinars that we have here available. There's some FAQs. There's also not only is there funding around the housing interventions, which could be annually up to $1 billion in housing for behavioral health that our county partners are overseeing. That's just one stream of the funding. Hopefully, a lot of you have heard about transitional rent, and that is a Medi-Cal benefit, and that's actually the kickoff of that is this coming January, and that is the first rollout of that is focused on individuals with behavioral health. And so just really whether you as a SUD provider want to jump into that space or maybe expand the services that you're providing or connecting individuals, maybe you're a residential facility or outpatient, but you have individuals that are in need of housing or going to need housing, just really making sure that you're aware of these different opportunities so you can help get them connected as well. So tremendous amount happening in the housing space. So if you're not haven't really heard about that, just want to make sure that you know what's happening there. Next slide. Another great resource, really big tenet of BHSA is also really ensuring that Medi-Cal is maximized. And so, as always, we're always working to increase the number of Medi-Cal providers. There's a lot of provisions in the statute that require that Medi-Cal be maximized. And so we have some training here, some provider training. We have some, of course, on our DHCS website, and we'll be rolling more training out for our providers in this space because we really want to make sure we're maximizing the use of those services so we can free up the other funding so we can just continue to serve as many people as possible in California. Next slide. And this is just one of my ending slides here. This is kind of just some additional resources. If you haven't come yet to our page on the website, or maybe you can't find us, here's a link right to Behavioral Health Transformation. Bookmark us, because like I mentioned, we have a ton of new resources coming out all the time. You can also sign up on our website to receive some updates. Maybe after this webinar, or maybe you're listening to this recorded webinar, you have some questions that you need more information on. We have this BHT info mailbox, and this is actually for questions that you might have or feedback. And that is organized just in one place, and folks will get back to you on that. Maybe you have, like, maybe you're new to BHSA and this is just so overwhelming for you, and you just really need to do some deeper dives and learn a little bit more about some of the topics I brought up today. We've held a lot of public listening sessions where we've just kind of walked through different components. And so if there's one that interests you, you might want to go back and look at some of those that are on our website as well. And then all of the infographics that I talked about today and resources and many others are also listed on the website. So those are all available for you. And then, of course, I think we already mentioned we'll be posting this recording and this webinar as well for folks that if you're like, oh my gosh, Marlise did such an amazing job, you have to see this. You'll be able to refer someone to that. All right. I think if we can move to the next slide, I think that is it for me. So we have time now. I'm going to turn it on over back to Rob, and we'll start doing some Q&A.
Wow, this is a lot of information to be able to absorb. And so I'm actually really excited to see some of the questions in the chat. But before we get to those, I wanted to let everybody know if your question's a little bit more complicated or longer and you want to ask it, just go ahead and raise your hand and we'll unmute you and we'll call on you. Can I take a point of privilege and ask one question before we start? One of the things that we're so excited about around substance use disorder being included within the Behavioral Health Services Act is representation. Because for so long, we needed to figure out a way to build relationships and talk to counties and talk to, talk about the services we're providing. How will we be measuring? How will the state be measuring the inclusion of substance use disorder services within the county plans? Because ultimately, we'd like to have parity within that process. So can you talk a little bit about how those checks and balances will go?
Great question. And first of all, I want to say like something I kind of failed to mention, like I want to make like this is a lot to learn. And I know I just crammed like a whole bunch of information. I don't want any of you to be overwhelmed. Like while this is a lot of new information and we've done so much in this space in California, like don't give up. Show up for whatever level of information you have. Don't feel like your voice doesn't matter, even though you may not understand all the acronyms I used or other things, because this is initiative voted on by the, Proposition 1, and so this isn't like a program. This is like a system transformation. And so anyway, I just wanted to get that quick encouragement. That being said, when you look at the integrated plan template, Rob, there's a lot of questions around stakeholder engagement where we're looking at all the required groups. There's a whole chart that shows us where they have to explain every single group, who was contacted, who attended, all these type of things. There's also parts of the integrated plan of around stakeholder engagement of like, did you take the suggestions or, different things like that. But I also want to say like, we're just one lever in this. Like it's by the time that the plan comes to us, that's, the pie has been baked. Now, granted, we have authority to, ask questions and find out, make sure requirements are met, but really make sure that's why I highlighted the Behavioral Health Board as well and your county partners. Like there's different parts in this process. Don't wait for DHCS to be the one just kind of making these determinations. We do look at local need. Is local need being met? And as this planning process continues to evolve and we start seeing some of the outcome measures, there's other provisions where we'll be able to see, especially with those phase two measures and those individual service level kind of metrics. Like, okay, well, we're seeing, right now we can see like you have high overdose rates around opioids. Like, how are you focusing in on that? But it's going to become a lot more specific as we get to those phase two measures, and especially when we get to have those incorporated, because we're going to be able to see, because there's measures around SUD specific measures, and so we're going to have a lot more information to really gain information of like, are counties really planning the funding to meet those local needs? And then when we have the reporting that comes back, then did they expend the funds in those spaces to meet those local needs? So this is a part of a process. So all that being said, like that's where we're really needing the SUD voice to come forward to be bringing that local need forward, because we recognize there are general struggles across California, but then there's very specific ones, maybe certain populations or whatever the case may be. But so we're looking at all of that when it comes to us. But like I said, don't wait on us. You guys get out there and make those local needs heard in your local areas.
I think that's a really great high level structural thing to point out is that the Proposition 1 through the act now includes substance use disorder as a larger statewide policy, but each one of these local jurisdictions or these county community planning processes are responsible for reflecting the local needs. And so as providers are engaging in that community planning process, they have an opportunity to really put the local spin on those items. Absent providers participating, that local spin won't exist. So providers not only have to do it to be represented, but also to make sure that the county planning process represents their local communities. That's really important. One of the questions that we had in the chat was, can you share the link to attend local meetings? And this is complicated because, like we just talked about, there's lots of counties and there's lots of planning processes. So, is there any clearinghouse? Is there any local or general or space that providers can go and say, "Oh, I want to be involved in the county process from Madera County and Los Angeles and San Francisco"? Is there any, place that they could see all those meetings?
So I've highlighted in this deck, and we also have it on our website, but the BHSA coordinators, and we made sure to talk to our county partners before we posted on that list. So that is our most up-to-date list, but you can reach out directly to those individuals where they have that information. Tracy already popped into the chat here that it should be on the county's websites and posting the meeting schedule. And then I also had in the link for the Behavioral Health Board, all the local contacts. So you can reach out directly to them to see when their meetings are being scheduled. So between those two resources, you should be able to be connected in to see who you need to talk to locally.
Yeah, I think the Behavioral Health Board is also a resource, not only for this process, but also as a thought leader around
Yes.
what the local programs need, right? And
Hmm.
so get to know your county, get to know your local behavioral health board, make the meetings, figure out how you can build that relationship, because then what you're planning to propose will reflect the goals and the needs of the county, the local behavioral health boards, and also what the providers actually need.
Definitely.
There is some confusion with people who are entering into this process for the first time around what can be funded and what can't be funded. And so one of the questions we have in the chat, well, a couple of chat questions we have is, can Behavioral Health Services Act dollars, can they be used for OPT? Can OPTs receive funding through Behavioral Health Services Act? And also, how does BHSA engage with in custody care or care around the reentry population? Can you talk a little bit about that?
So BHSA funds cannot be used for like incarcerated settings. So that's always been kind of from MHSA, and that transitioned over. That doesn't mean, but once someone's out of that incarcerated setting, the funding can be utilized. So that just to clear that one up. Around like the different provider types that could receive funding for BHSA, once again, it does have the allowance for SUD. and the eligibility criteria and everything is all listed there. And it isn't just for treatment services. There's also, as I keep mentioning, the housing bucket. But with the housing bucket of funding, it's not just housing services for either interim settings or permanent supportive housing. There's also counties can use up to 25% for infrastructure. So if they wanted to build out, let's say, a new sober living environment or recovery residence, they could do that. So, like when you're looking at that housing, it isn't just housing for mental health. It is also for SUD that is allowed. And there are also provisions around ensuring that medications for assisted treatment are allowable in those housing settings. Um, so for like as can an individual provider receive funding? I mean, the answer is if you're providing SUD services, yes. Counties are though, really going to be because we're holding their feet to the fire to ensure that they're maximizing FFP. That's federal financial participation, basically that federal dollar that matches our state dollar for Medi-Cal services. And so you're gonna you're gonna be asked to be Medi-Cal certified, I can tell you that. But if you already are, you could be serving individuals that don't have Medi-Cal, because that's really BHSA can either be that match to that Medi-Cal dollar, that federal dollar, or it could serve individuals that just don't have the coverage, either uninsured or maybe their commercial insurance doesn't cover the service that's being provided.
Federal financial participation is key in this for system care, but it's also key because it allows us to draw those federal dollars in and ensure that the state isn't paying 100% of these rates of these services. And so as counties are looking at maximizing their FFP, partners at the provider level need to also make sure that they're matching that sense of enthusiasm because if we pull in the 50% or whatever it is for the FFP, that means more money for the state, more money for the system, and more services for consumers. And so, as we're engaging on these types of things, yes, the BHSA dollars, because it's the millionaire's tax, is a state fund, but we need to be able to draw down those federal dollars and be good partners to draw down those federal dollars so that as the state looks at it, we have more money to provide those services. And I think that's really important. The housing part is really interesting because we get to be able to provide, these services now. But one of the things that is around the housing policy is housing first philosophy. So can BHSA housing services, do they must they follow a housing first philosophy or are the funds also reserved for recovery housing?
Yeah, so we've done a lot of work with our department and working with like other state departments, housing and community development in particular, and really explaining SUD in particular and how we need medications for assisted treatment in these facilities. We need to fund recovery residences. So yes, you'll see in the BHSA that you can fund recovery residences. And we've really fought for that. And we've been doing a lot of education in that space to help them understand like the impact around the housing first principles and we've made I think a lot of headway in that space. So yes, that is available and once again there's just so much coming out. And even kind of to your last question, Rob, I failed to mention we do of course have our justice initiative where we are just been kicking that off at DHCS, where we're providing care within an incarcerated setting and then linking folks to Medi-Cal services outside. So, like, that's another kind of linkage in all of this. I would just say, and kind of back to the housing, but in general, there's just a lot of opportunity right now. There's a lot of opportunity and a lot of interest to expand these services and everything you said about the FFP. And, I think one thing I need to make sure I highlight, BHSA doesn't bring new money in. It just reprioritizes how that funding is spent. And it really prioritizes on priority populations. And those are individuals at risk of institutionalization, those involved in the justice system, our child welfare, our unhoused. And so it really does shift where that funding is expended. And so with those shifts bring opportunities. And so once again, keep learning about it and seeing what you might want to, be involved in as a provider.
Yeah, I that's a really important thing to call out is that this does not bring in new dollars, but it does change the priorities in a really significant way. So as those priorities are shifting, we need to prioritize these processes so that we can show up because the state put together this proposal so that SUD is represented, and if SUD doesn't show up, the providers don't show up for that process. We need both parts of this equation to actually work. It looks like we have Jess that has a question, so I'm going to go ahead and unmute you, Jess, and then you'll be able to ask your question. Go ahead, Jess. Okay, it looks like Jess is having a little bit of a problem unmuting. So I'll just say at while Jess is unmuting, um, there's a lot of really great resources in the chat. And it's what do they call it? Like drinking from a fire hose. It's a lot to deal with. But it's also like really exciting. So as you said, the webinar will be available after, but if people have questions about some of these resources, I assume there's a way that they can get in touch with DHCS to have that clarified.
That is our BHT info that is kind of on that last resource slide. And so, yeah, feel free if you have questions or any type of feedback, you can provide that there. And I've got a lot of staff that look at those emails and provide you with the response that you need. So, and yeah, I can't overemphasize how much this is to learn. But I also equally can't overstate how behavioral health is for SUD and mental health. And so, this is, you know, some new opportunities for SUD providers. And, we really want to hear from you. And more importantly, we want you to be heard at the local level. And so, continue for those of you that have been having your voice heard there, continue. And then for those of you that haven't, like, show up and participate.
We have a great question about the local level item you
Right?
just mentioned from Denise from Behavioral Health Services. What do we do to stand out in the county process to ensure that SUD is funded fairly? Which is interesting because it would be helpful to know sort of if there's any priorities outside of the populations that DHCS is looking for within these community plans. And also, is there any trends or anything that you could share to make sure that as providers are looking at ways to propose programs and funding, that it really meets some of the state priorities?
Yeah. I think make sure you understand the different funding sources that are already SUD specific, like the block grant, the substance use block grant. That's about 250 million a year that counties receive. Of course, the opioid settlement funds, that's a part of this as well, the realignment. But as it pertains to BHSA, like specifically ask, where are you focusing on SUD for your BHSA funds? Because that is new. And then I'm going to pick on Tracy to see if she has anything she'd want to add.
So in the chat, I put the policy manual for Behavioral Health Services Act. We received authority through statute to be able to, rather than promulgate regulations, which is a long, lengthy process, be able to have bulletin authority. So that policy manual is basically regulations. So counties are to follow what's in there for the community planning process. Very shortly, we will have some information about compliance and monitoring and the ability of the department to sanction counties should they not be following something. So highly encourage you, if you're interested in the housing interventions, to look through that policy manual. Would also encourage you to look at your county specific data. What is it telling the county? What are the needs that are not being addressed? Because understanding the data and being able to interpret that, push programs that would create positive gains is something that you can advocate for at a provider level very easily. So those are kind of my two things, be informed, understand what counties are required to do, and understand where is it you want to place yourself in these new opportunities for you.
That's that's a really great point, and I'm going to use a term that I don't like, but it's appropriate. Really, providers should be taking the words crosswalk. Really, providers should be taking what their priorities are, what they see the need from a community perspective, taking the policy manual and then crosswalking that to figure out where they can have the highest impact. Because I think that really we're as a community wanting to make sure that we have the highest impact with these dollars. And so the policy manual really is going to be that document that you can use to to really see like what you were talking about, compliance and priorities, right?
Mhm.
Yeah.
Yeah, and I would also add to that, Rob, even after the county is done with their planning process and everything is set, like what role can you play? What solutions can you offer? And you could bring solutions also to the planning process, but like don't let it end there. Like it's a lot for counties to process themselves right now. And this is, like I mentioned earlier, this isn't a one and done. This is going to be an ongoing process. So be thinking about as you are learning about what's in the policy manual and these opportunities and you think about, I could do X, Y, or Z, really bringing that to your county partners to be able to offer some ideas and solutions as well.
Yeah. There's a question in here from Wes Saver from Health Right 360 around on feedback sharing. So, how is the state capturing county level feedback processes to document how they're being conducted so that best practices can be shared and more counties can align their feedback collection? And this is really important because really the county process in Humboldt County should look and feel the same as Los Angeles County or Merced. It's the local programs that should look different, but the county processes should be very similar. So, do you have any thoughts on how that works?
So part of that is, I mean, when you look at our integrated plan template, like we're really trying to get at the heart of that and we'll see how well we did. This is new for us too. But we want to learn like lessons learned as well and like more trainings around the community planning process, learning from which counties are doing it well. I mean, the counties have been doing a community planning process for mental health for a long time. However, we didn't have the visibility into it from the department lens. You folks haven't either because you probably weren't at the table because wasn't really funding for you in that process. But so a lot has shifted. And so that's something that, we're watching as we move forward and trying to learn ourselves, but want to help our county partners. I mean, one of our first steps was putting that guide together to help, because we also recognize there's turnover at the county level and there's best practices in theirs and there's learnings and there's other things. So we'll continue to, do more in that space. But right now it's all happening. But we are going to make sure that we do a look back too and see what other help we can provide. And then individually, if there's any, something in particular that comes up, obviously working through that. I do just want to say really quick, there was a question in the chat. Do you have to be providing Medi-Cal to get BHSA funded services? I guess the answer for that is maybe, really kind of depends on who you're serving. We are not providing BHSA funds anymore for individuals that have Medi-Cal and aren't getting like it through a Medi-Cal provider. Otherwise, we're not maximizing those resources that we have. However, there are services under BHSA that aren't Medi-Cal eligible. And so for those instances, of course, we're funding those services through providers that don't have to get Medi-Cal for those services in order, like housing. There's not a Medi-Cal certification for housing, as one example. So just kind of depends on what the services that you would be providing.
Speaking of housing, so there was a question here on sober living, on BHSA funds for sober living. Pop quiz for us. That I think we can, right?
Yes.
Wonderful.
It's one of the, and it's in the housing interventions list as one of the eligible facility types.
Wonderful. So there's a lot of resources in here. And like I said a moment ago, DHCS is a fantastic partner around the engagement. And so there's a link, there's an email address in the chat. So if you have any further questions after this webinar, it's bhtinfo@dhcs.ca.gov. That's bhtinfo@.ca.gov. Sorry, bhtinfo@dhcs.ca.gov. Okay, wonderful. Um, I think we've captured all the questions in the chat. Does anybody else have any questions they'd like to raise their hand with? Wonderful. Well, I'd love to pass it to you, Marlise, for closing comments. Thanks again for doing this webinar. I know that we have a lot of people here today, but I'm positive that the recording will help people also.
Awesome. Well, I super appreciate you all making the time for me, and I hope this was valuable for you. And I hope you just continue to show up. And, once again, don't be discouraged. It's a lot of information, but like this is going to be a transformation that is going to impact our field for many, many, many years to come. So, and with that, I hope you have a wonderful Thanksgiving with your friends and your family and loved ones. And I am extremely thankful for all of you and the work that you do for those in California that need your help. So thank you so much. And we'll see you out there. Take care.